My name is Lisa Kahn. I am a second-year MSW student from Stony Brook University. My op-ed is on ADHD and young children, misdiagnosed, overdiagnosed, and overmedicated. Society holds very high standards and expectations of students' performance. The powers that be are more concerned about the test grades than actually focusing on the different styles of the learning experience and the absorption of the material. Children have different styles of learning, and the teachers get graded on their students' test performance, putting more pressure on the teacher as well as the students to perform. These standards begin as young as 4 or 5 years of age, but could begin sooner. Typically, a child struggling could be acting out or giving the teacher a difficult time. It is much easier to medicate the child, but how do we know a child has ADHD? Typically, a clinician looks at the DSM-5 criteria, but is that enough to diagnose and medicate? The criteria in the DSM-5 are methodical, but if differential diagnoses are not investigated, this form alone of diagnosis may not be accurate. Additionally, drug companies are reformulating drugs and marketing these quick-fix money-making solutions. This increases the likelihood a child will be diagnosed with ADHD. Even prior to psychological testing, a comprehensive assessment is complete. This makes the job of a social worker more challenging. The school puts pressure on the social worker to convince the family of these cookie-cutter solutions. A social worker is taught to elevate and respect the inherent dignity and worth of each person, along with their differences, in a trustworthy, caring, and respectful way. How is a social worker to stay true to the values and principles when they are taught, when the school and society have a one-size-fits-all attitude? I argue more and more children are being diagnosed with ADHD and medicated inappropriately. There is a widespread problem of overdiagnosing, misdiagnosing, and overprescribing medication for ADHD in children specifically between the ages of 4 and 5 or younger. The first form of treatment should not be medication. There are effective evidence-based alternative treatments that do not require medication. The youngest of elementary school children, ages 4 through 5, are significantly more likely than their older classmates to receive a diagnosis of ADHD. Although this phenomenon has been labeled overdiagnosis, one could argue that immaturity could be mistaken for ADHD and misdiagnosed. So, what is ADHD? ADHD is a neurological medical disorder that affects the behavior of individuals. There are gradual differences in the severity, such as mild, moderate, and severe. Children with ADHD may daydream and seemingly appear to not be listening. They are easily distracted, disorganized, and they lose things. They talk too much. They're fidgety, forgetful, maybe act impulsively, displaying risk-taking behaviors, and have trouble making transitions, to name a few. When children begin kindergarten in the early years of elementary school, prior to the standard age of 5, it is more likely they could be misdiagnosed and overtreated for ADHD because they happen to be relatively immature as opposed to their older classmates. There are many differential diagnoses that come along with ADHD. Before making a diagnosis, a medical exam must be completed to rule out traumatic brain injury or any other serious medical conditions. Some physical symptoms, such as thyroid disorder and heart conditions, can cause symptoms and mimic anxiety or ADHD in children. Some differential diagnoses according to the DSM-5, are oppositional defiant disorder, intermittent explosive disorder, autism spectrum disorder, reactive attachment disorder, bipolar disorder, disruptive mood dysregulation disorder, to name a few. The most common differential diagnosis that can be confused with ADHD is anxiety disorders. Anxiety disorders can cause restless and misconduct and could be mistaken for ADHD. The difference with children who have anxiety and ADHD are children with anxiety tend to show compulsive or perfectionist behaviors, while kids with ADHD tend to have organizational issues causing anxiety. Medical and social model and barriers. Unfortunately, it is society which disables people with impairments, and therefore any meaningful solution must be directed at societal change rather than individual adjustment and rehabilitation. The common go-to in this medical model is to medicate. The social model defines the child's behavior based on societal norms. The medical doctors using the medical models assumes this is the only solution. In other words, barriers could consist of a child having difficulty paying attention, or the child could be more active and challenging to handle in school. The medical model masks the symptoms with the medication, while the social model accepts this impulsive reaction as a fix. One solution within the schools would be to offer teacher training of cognitive behavior therapy and solution-focused therapy to be provided by a social worker as a form of teacher classroom intervention. Another intervention solution could be the school hires more social workers specifically to provide the classroom with push-ins. The social worker could observe and intervene when necessary. This might take some pressure off the teacher. The teacher could spend the time teaching instead of losing time disciplining. The social worker could intervene with empathy instead of embarrassment. It could be stated that an unethical solution would consist of the parents strongly being told by the school without accurate evidence-based proof to place their children on medications. Parents have been even told by the school without evidence their children in fact have ADHD. They are neglectful if they are not medicating their children. Children are being prescribed medication as a quick fix rather than being given full assessments and psychological therapies, which may take longer and cost more, but ultimately are better in the long run. The typical situation within the social model could be the school contacts the parents of the young kindergartner telling the parent their child may fail and need to repeat the grade. School-age children are expected by society to sit and focus for great lengths of time, and if they cannot self-regulate, they are either labeled as per society as defiant or they have ADHD. The social worker may provide family systems therapy as another form of psychotherapy, which helps the family and the individual resolve their problems as a unit. Understanding the dynamics of the family unit as a whole is one of the most important solutions a social worker could do to help the child as well as the family navigate their experiences. Ethical issues associated with diagnosing young children. One ethical concern is within the classroom. The teacher may not purposefully bring attention to the child's differences in front of the class, but this is the typical occurrence. The child becomes stigmatized by thinking there is something wrong with them in comparison to the other students in the class. This stigma can create negative automatic thoughts within that child. This could cause the child to feel different. If this is not handled well, it can prove to have negative long-term lasting effects on the child, causing more anxiety and even depression. Rather than addressing the specific cause of the child's specific problem, they are looking for a quick solution by medicating the child. Medication should be the last, not the first solution. Typical medications prescribed. Subsequently, as social workers, we are often the professional who sees the individual most frequently. We need to have familiarity of the medications generally used for ADHD. Most likely, questions could come up about the positive effects and side effects of the medications, as well as the obligation of sticking to the therapeutic medication management. There are two brain chemicals called dopamine and norepinephrine. Dopamine is one of the brain's neurotransmitters that contributes to feelings of pleasure, like an internal reward system. Norepinephrine is a chemical hormone that functions as a neurotransmitter and assists in the child with ADHD to focus. A typical medication prescribed for ADHD are stimulant medications. There are two different stimulants typically prescribed. The first is methylphenidate, and the brand names are Ritalin, Ritalin SR, Methylene, Concerta, and Medidate. Methylphenidate affects the central nervous system. The other is dextroamphetamine, which affects the central nervous system, and the brand names are Adderall, Vyvanse, and Dexedrine. If these medications are taken in error or in excess, many side effects can occur. Side effects of the medications may be worse than the symptoms of the ADHD itself. Some symptoms to look for are sleep issues, decreased appetite, headaches and stomach aches, moodiness, and irritability, tics, to name a few. Medications could include short-lasting, about 4 hours, and long formula lastings, about 14 hours. Children displaying difficulty going to sleep could mean the medication is still active. While short-acting dose is given, it may not be enough. The child may need multiple doses. These medications can cause more harm than good. When a child doesn't sleep, that in and of itself could cause the child to be irritable and tired throughout the day. What are some alternative treatments that can be used? Alternative non-medication interventions to help treat ADHD are cognitive behavior therapy, solution-focused therapy, motivational interviewing therapy, and mindfulness, to name a few, and family therapy. Additionally, some say removing chemical additives such as food dyes, preservatives, and MSG, in addition to the removal of sugar and processed foods, while in contrast, adding fresh vegetables and fruits to the diet could help lessen symptoms. The first therapy descriptions are cognitive behavior therapy. This is a form of therapy that is focused on the present rather than the history and the causation of their difficulties. Cognitive behavior therapy focuses on moving forward and developing more effective ways of coping with life. Another is called behavioral parenting training. This type of training educates parents on how to change the environmental conditions that trigger and sustain inappropriate behaviors. This approach emphasizes the use of positive reinforcements. This approach has been proven highly successful treatment for ages 3 to 11 who are inattentive and or disruptive, regardless of whether they have ADHD. Another is solution-focused therapy, and is a type of therapy that is future-focused, goal-directed, and focuses on solutions rather than problems that brought the client to seek therapy in the first place. Mindfulness is another form of therapy that helps train the brain to stay in the present moment, while motivational interviewing therapy is a client-centered therapy used for eliciting change in behaviors by helping the client explore and resolve ambivalence. Also, family therapy is a type of systems therapy that focuses on the interactions between the family members and emphasizes family relationships. Social work principles consist of the respect for independence, compassion, safety, and fairness. Where do we as social workers fit into the context of the problem? And how can we as social workers help with the solutions? It is said that parents only know what they are taught. Psychoeducation is the answer. With that in mind, the job of a social worker is to help parents reduce discord and fatigue and that might have built up in their relationships and help guide them to a more positive environment. Parents need to understand how the whole gamut of traits associated with ADHD and parenting skills can offer parents help. navigating a child with ADHD. Without those important intervention skills, the family environment could become tumultuous and cause stress within the home environment. A child has a better chance of success when the parent is given parenting solution therapy within the home environment. There's a great need for parents to be taught how to parent a child with ADHD and the anxiety that could come along with being a parent of a child with ADHD. Special training to help parents navigate their child's behavior and the parents' responses should be a prerequisite in schools. As a social worker, it is important to address each child holistically, upholding the social work values, treating each person with respect and dignity, and building trust, showing they care in a respectful way. The end.